Welcome, friends, and thank you for tuning in to another live program of the Optimal Health Program. I'm Dr. Chris Calapai, and we're going to talk about a variety of great things here as we've done in past and certainly going forward. Today, we're going to talk about obesity and overweight, a very, very serious problem in the country and in the world. I'm going to show you a very scary statistic. This graph will describe to you that nearly half of Americans will have obesity by 2030. So this is completely out of control. I was surprised to see that, and most individuals would not know the rest of the statistics. So between age 2 to 5, 12% are overweight. Between age 6 to 11, 20% overweight. 12 to 19, 22% overweight. And yet another study talks about more than half of the world's 8 billion people will be overweight by 2035. This is completely out of control. And of course, there are many reasons: poor diet, people not doing as much exercise or activity anymore, decline of hormones. There are other things that could affect hormone production, like exposure to chemicals or heavy metals, which is extremely common. But we have to take the bull by the horns to be able to change this process. And in the 36 or so years I've been in practice, the idea for me has been to learn as much as we can about your body and fine-tune everything that we find so that you can create great health going forward. And there isn't a day that's passed by in all those years where I haven't seen people that need to lose weight, want to lose weight. Some people need to lose a little, some people need to lose a lot. So it's the same understanding. There are a few different things that are always within that recommendation to help to lose weight. One of them certainly is to increase exercise. So at the very least, I tell people you should walk every day for a half hour, if you can, 45 minutes. And for those people who need the visual, and a lot of people do, and we'll be getting more to that within a little bit, but if you walk outside and you go to your corner, there's your target. You have the corner right in front of you. You see the target, you hit that target, that's the first mark. You can make a left or right, go to the next corner, but walk a little faster. So slow initially, then brisk, then from the next corner to the other, fast, slow, brisk, fast. You can keep going brisk, brisk, fast, brisk, slow, brisk, keep changing it up. You can go straight down, go to a park, go to a track around a school, etc. But you've got to get that half hour to 45 minutes of activity in every day. Of course, if you go to the gym, elliptical, weights, combinations of different things, Pilates, yoga, there are many different things to do. And I tell people you want to be able to do a little bit of each of them because it keeps your body, I don't want to say guessing, but it keeps your body going, enhancing blood flow, enhancing muscle strength and tone. And the combination of the cardio with the weight training gives you the best outcome. And doing it more often gives greater result than doing it less often. So you want to be able to do your cardio every day, and you want to do some weight training and strengthening a couple of times, 3 times a week or 4 times a week. So that's critically important. Diet-wise, because all the food now is GMO and has all sorts of garbage in it, and has for a while, you want to be able to eat organically. You want to be able to cut your carbohydrates down. Every effective diet that works is a low-carb diet, because when you cut the carbs down, your body burns triglycerides right away. Second thing you would burn are cholesterols, and then you start to see your weight coming down. That with the exercise is a great combination because you're achieving that much more. For the individuals as well that have decline in hormones like thyroid, DHEA, testosterone, IGF-I, or the active component of growth hormone, the low levels of the hormones make it hard to burn cholesterol, sugars, and fat. So we look at that within your blood test and allow correction of those things. So exercise, low-carb diet, hormone correction, vitamin correction, critically important, because your vitamins are food for your cells. And as your vitamins are in great range, your cells will do far better. Yes, there are additive medications that can help to decrease cravings. And for some of those, the weekly injectables, we talk about the semaglutide or Ozempic, the Mounjaro or tirzepatide. In short term, you can use those, and we've done that for patients. It gives them a little bit of that edge, and if they need to lose a significant amount of weight, in many cases that weight loss is not going to happen unless you really cover all the bases and work hard at it. So the medications can be used short term. I don't think they should be used year after year. Maybe longer term in patients who need to lose a lot more weight or the sugar's completely out of control. But you have to have those core things done. And right off the bat, it should be low carb, exercise, correct hormones, vitamins, minerals. We've seen some great weight loss in patients. And for many, many years, up until these injectables came out, patients did really well with low carb, the exercise, correcting the vitamins, minerals, or hormones. So that's really the hallmark of the process. Learning how to eat is also critically important because people get up and they think, I've got to have some sort of breakfast food, which is not true. And people will opt to have cereal because it's easy and it's ready and it's quick. Or they'll have bagels or buns or just way too much carbohydrate. For most of my patients, we typically talk about having a protein shake in the morning. And you could take either cashew milk yogurt. It's made by Forager Project. You can get that at a Whole Foods. So it's a drinkable yogurt. Put a scoop of the protein powder in that. Put some berries in that and make a smoothie. And there's really no carb. You have about a gram of carb. But you're getting the nutrients from the protein powder, 21 grams of protein. You're getting vitamins. And it tastes good and it's healthy. Far better than what most people have for breakfast anyway. Some people may opt to put a plant-based protein powder in their coffee in the morning. Stir that in and have that as their breakfast, as their meal. Still better than what most people have, for breakfast in general, the general Western diet. So combinations of things, and you could change if you like. There are a variety of foods now that are grain-free crackers, grain-free bread, wraps that you could use made from almond or cashew. So it's easier to wrap some foods up and have that meal and not be exposed to the high carbohydrate count. There are also companies that make cereal from sunflower seeds, a variety of natural substances, nuts that have no grain. So they have very, very low carb. So there are ways to do this. It just takes a little bit of learning, and that's why we give out our handout and give out a couple of pages of food options for you to have. So we really need to change this mechanism because there are far too many people developing diabetes, hypertension, heart disease, plaque, nerve issues, and damage. So the weight issues also rob your life of happiness. They also make it harder to function at work in a variety of different ways. So this is why we want to pull this into perspective. My initial comment is to start off with a big blood test. We do that. It's about 20 pages. Learn everything about your body, maximize your health, correct each of these areas, and you start to see your body lose weight in a very sensible, direct way. And people can track how much better they feel. And we do that. We have them, fill out some paperwork so that when they start, they list all the different problems they have. We call it a symptom checklist. And of course, you can put your weight, your blood pressure on there, your blood sugar readings, and week to week, keep tracking and watching to see your improvement. And then over the course of a month, people will come back and say, these are all the things that I saw that were improvements in my body. So we want to get people engaged in the process. So very important to create a plan, and that plan, you want to have checks in that plan to make sure you're reaching your goals. So very, very important to do. As I've mentioned before, there are far too many diabetics, over 40-some-odd million diabetics in this country. And the issue is that will rob you of years of your life. Type 1 diabetics have a very, very short lifespan compared to non. And type 2 diabetics end up with all sorts of secondary medical disorders. And the same thing can happen with obesity. So we have to start at the home, changing the diet, teaching kids so that as they grow up, they're eating good foods and better foods as opposed to just randomly eating horrible foods. Okay, so if anybody would like to call in, phone lines are open, 1-888-420-9272, 888-420-9272. You can call and ask questions. This program's live. And relatively soon, we're going to get a little cool and funky here with some graphics because I've learned a great deal from Frankie, the most awesome producer of all producers. And I'm going to go out and buy a tablet or an iPad mini and be able to make little diagrams and draw little pictures and create some catchy stuff for those people who like the visual aspect of a program. And as I've been told by a very close friend, there are many people that don't do well just with auditory information and that really respond to the visual graphics and colors. So I'm learning all about how to fine-tune this and to make this work for everybody. We also would like your feedback. So if you watch the program or you listen to the program on the 15 other podcast platforms that we have going, We'd love to hear from you and give us an idea as to what you think. Okay, once again, 888-420-9272 is the phone number. If you'd like to call in and ask a question, you could do so. We've got some emails from patients that will hit my website and ask questions. We get so many of these, and I appreciate it. I think it's great. And the reason we've done that is because people need to have answers to questions, and traditionally doctors don't answer questions. So they can't answer the question. They can't go beyond and explain how B12 has to be converted to become active in your body. And they can't explain how the diet works or why the hormones are important. So that's always been the focus of my approach, dealing with people from all walks of life, every type of job, every type of strata, income and otherwise. I like to put things on an easy-to-explain level and allow people to learn. I point them towards articles. We hand out articles. We give them things to read so that they can really embellish their understanding about what their health state is like and what they're doing. So the emails we get literally every day, people ask about one topic or another. You could certainly make an appointment online. We've put that availability on the website. And I like patients that call the office and they speak to the staff. And, it's a much better way to understand, what we're doing. So one of the first emails is a gentleman, Bill, who says he has shoulder pain. He's 37 years old. He has a decrease in his range of motion, difficulty lifting his arm. So this is a really common problem. The population of men and women in their 30s and beyond with shoulder problems is very, very high. The shoulder is not the strongest joint in the world. Even those people who do a lot of exercise and work out and have good muscle strength and ability, your ligaments, tendons, and cartilage, will receive wear and tear over time. And some people who do contact sports, the abuse on that joint becomes pretty significant. The first thing we talk about, besides a good exam, either by an ortho or the family doctor, if the family doctor does a good ortho-type exam, is to look at range of motion, see where there's pain. If you can't lift your arm up, then that may be a severe mechanism of tear in the supraspinatus or infraspinatus tendon. Rotator cuff always is important to look at. Palpation, pressing on the area, can give us an idea as to whether or not, for example, the biceps tendon is damaged or torn. So rotating your hand out like this, pressing on a little notch right at the top of the humerus is where your bicep tendon exists. If there's pain there, or you can't pull your arm up, or there's no restriction to pressing your arm down, you may have a biceps tendon problem. But best test of all is the MRI. The MRI will show us everything about that joint. And similar to that machine in the deli where they're slicing, through whatever meat people are getting in the deli these days, I usually give the analogy, there's some sort of meat, I guess it's bologna, but it has olives in it. I don't know if they call it olive loaf. Yeah. So if the olive is 3 inches off of the edge of the bologna, you start slicing, you see no olive yet, but when you start to see the olive, you're getting slicing through the olive and looking at the entirety of it, you can really clearly see in the joint where you have damage, ligament, tendon, cartilage, cuff, bone, all of that. So the MRI is the best type of test because you're getting that sequential picture and you're seeing millimeter pictures going all the way through the joint. So if there are tears and they're minor, then some people might opt not to go for surgery. And we're not a big fan of surgery unless you absolutely positively need it, like your tendons are completely separated and need to be reattached. Physical therapy might help, but it's going to work the muscle. It's not going to make your ligament, tendon, or cartilage grow or repair. So those individuals have the option of doing two different things. One of them could be PRP. Platelet-rich plasma therapy is where we take your blood, spin it in a high-speed centrifuge. My PRP is different than all our PRPs because I have a 4,000 RPM centrifuge that we use for stem cell. So when we draw blood and put it through that centrifuge as opposed to the regular, slower blood centrifuge, we get a great deal more of that unbelievably perfect 10 cc's of PRP. And we can inject that into where the damage is based upon what the MRI describes and create some repair. That may be all a person needs if it's very mild. If the wear and tear or damage is beyond mild or multiple places, then typically we opt to do stem cells, where we take those cells from your body. These are not from someone else. They're your stem cells. That's the most important initial comment on it. And at the crest of your ilium, where, if you can see this spinal diagram, if you turn towards the back, and this is your sacrum, the triangular bone between your two hip bones, the crest of the ilium ends in a little fat bump here, and that's where we extract the bone marrow from. It takes about a minute and a half to do that. As we do that, we then put that into a centrifuge vial, spin it at high speed, and that's done for a half hour. And at the end, you're getting the stem cells extracted from the bottom of the centrifuge vial. And then we use that to inject joint. We can do it intravenous for liver, kidney, heart failure, lupus, rheumatoid, diabetes. We do intravenous and nebulizer for bad lungs, COPD, pulmonary fibrosis, emphysema. We do intravenous and then nasal droplet, where you're laying on your back on the exam table. And with 2 syringes, one at a time, we drip the stem cell liquid into your nose so it hits the back of your nasal cavity, gets into your brain. And certainly you've seen some of the videos we have here of the veteran blown up in a vehicle in Afghanistan. We also have stroke patients, video for a stroke patient you've seen. And we have lots of other videos on the website, but we're going to interview a great deal of the patients with their results. Gentlemen with cluster headache. So the list goes on and on. So that's a mechanism to create growth and repair of damaged ligaments, tendons, and connective tissue. And we've seen great results with that. So the process takes about a minute and a half to extract, half hour to spin, and then put the cells back into your body. That would be the ultimate mechanism for that. But I tell people, again, look at the videos on the website because you'll see and you'll hear patients' actual stories. The website is drcalapai.com. Second email we have is from Julia. She has low back pain and mostly on the right side, right leg. Been told she has sciatica. So low back pain is extremely common of all ages, of course, much more so as we get older. But in many people, as your low back becomes a little bit unstable, your ligaments that hold your vertebrae together, once again, here are the green-colored vertebrae. I'm not sure how well, you actually can see that pretty well. So the vertebrae start to grind down on the disc, and that disc can bulge and hit the nerve and cause pain, or the disc inside has a nucleus, like a marble inside a hockey puck, for lack of a better description. If that disc herniates and gets stuck outside and constantly presses the nerve, which, if you can see this little red dot, right there, where my finger is, that's a herniated disc. So that will show you how that pressure on the nerve becomes constant because that herniation has occurred. So doing an MRI, we'll see all of that. And in many cases, we want to stretch the back, take some of the muscle spasm away. We could inject and help to decrease some of the inflammatory mechanism. There are VAX-D machines that will provide traction for people where you go 2 or 3 times a week to keep stretching that out. Massage, physical therapy, great components. We would use PRP, platelet-rich plasma, and stem cell if there's significant damage to the ligaments that hold everything together. So the sacroiliac ligaments, going from the sacrum, the triangular bone at the bottom of the spine, and the ilium, if we need to repair and strengthen those to hold everything in place, then that's what we do. But it all starts with a good physical exam and the MRI. Absolutely need to have the MRI. Okay, once again, phone lines are open, 888-420-9272. If you'd like to call and ask a question, you could do so.
So we have a call. We have a question in the live chat.
Ah, perfect.
It's not necessarily regarding what you were talking about, but
could be any kind of question about anything.
We love it. When using a mouse, I guess a computer mouse, for a long time, I get this red, swollen, and kind of painful red spot on my hand. Mm-hmm. How do I prevent?
Is it near the wrist or is it?
I'll find out.
Yeah, we have to figure out where that red swelling issue is. For a lot of people that use a mouse or work on a computer all day, their hands are kind of popped up in a position that puts pressure on the wrist. So sometimes that creates a little bit of swelling in the area.
Yeah, bottom of the hand, top of the wrist.
Yeah. So you'd want to have a doctor examine that because you want to be able to see whether or not there's swelling inside the joint. For some people, there is. And for a small percentage of people, that could be the beginnings of what they call carpal tunnel syndrome, where the nerves, the blood vessels, ligaments, and tendons that go through the wrist are affected by that swelling. Yet other people that might be older could have a different mechanism of inflammation. Some people could have rheumatoid arthritis, where joints will swell, even with a little bit of activity, but that's an autoimmune mechanism where your body's attacking itself. More rare for what you're talking about, there are some people that have Lyme disease that don't know, and all of a sudden one joint starts to act up, and then you start to have more progression. So a good blood test would be important. certainly a physical exam. So for people that have carpal tunnel, if you have your hands as if you're praying together, you might feel a lot of pain if you're pushing your hands together like that, or the other fashion where you're pushing on the back part of your hands. If those two manipulations are negative, then probably wouldn't be carpal tunnel. But, if it's been there for a while and it's not relenting, maybe an X-ray or looking at the bones to look for arthritic change, or an MRI, looking at the softer tissues, ligament, tendon, cartilage, connective tissue. So is this something that's been there for a long time?
Wait on that.
So
waiting on the
we're
delay.
texting back and forth.
I like this live chat where people ask questions, though.
Yeah, it's great. Love it. This is great stuff. So, yeah, you really want to find what the underlying mechanism or underlying cause is. And again, a lot of people have repetitive use injuries to joints because they're doing the same sort of thing over and over again. In some cases, doing a little bit of PRP would be great in that area because PRP is using the growth factors, 7 growth factors from your blood to create repair. So putting it in that spot, wherever you have the wear and tear, can make a very big difference. Some people do better with ice to decrease what could be swelling. And I've seen some weird things, too, where people have allergies and they have aches and pains in their joints, but at the same time, that allergy, besides the antibodies bound to the allergen getting to your joint to irritate it, might also have redness or discomfort on their skin. Unusual presentation, but may very well be so. So I would imagine this is not an immediate process because a person might not complain if it happened once or twice.
I had that problem. I had to get those like cushions, because I'm on the computer all day.
Yeah, of course. It's smart. And I have friends that have those curved keyboards. It makes it much easier on your wrist with a nice big cushion. So it makes all the sense in the world.
I guess they were happy with their answer.
Okay. Well, we can get back to that. And for anybody who would like to call in or type in, you could do so now. 888-420-9272, 888-420-9272. Let's go to our next email. This is a great question. The patient has leg cramping, Tom, and pain throughout their leg, and wanted to know whether it was nerve-related or musculoskeletal or vascular. So this is something I've spoken about a great deal over all the years that I've been doing this, because as an osteopathic physician, we're preeminent. We know so much more about the musculoskeletal system and how it affects your body. And the distinction between a vascular or a neurologic mechanism is relatively clear. If you have a vascular problem and you're not getting blood flow down to the muscles or to any part of your body, and let's just say for sake of discussion, it's the leg, as you start to do activity, you can't get the blood flow to meet the demand of the muscle. So you'll have muscle pain. And every time you start that activity and you get into it, you're held back by that discomfort. And when you're not doing the activity, it may not be there at all. That's vascular. There are tests we do for vascular evaluation, Doppler ultrasound exams looking for flow down the arteries and then vein return. So those are good tests to do. We set those things up in the office as well. An outside company comes in and they perform the tests, and we get a beautiful report to, am I talking with my hands too much? Not at all. I mean, I am Italian. So,
you beat me.
This is what we do.
That's what we do.
I just see myself talking with my hands all the time. So, yeah, the vascular tests would show what's happening there. And the older population can have plaque in the blood vessels that can create that and narrow down the flow. When you look at the neurologic or musculoskeletal component, if a person still has discomfort no matter what position they're in, that may be that disc hitting on the nerve and a herniated disc hitting the nerve, creating that symptom going to that area, or referred pain going down the leg. So for that, a nerve conduction test would be genius, because a nerve conduction test determines the flow from your low back down to your leg and where there may be interruption in that nerve flow. MRI would be good to evaluate whether you have the lumbar disc degeneration or herniation. Range of motion testing is always important, looking to see how different positioning may affect the discomfort. Some people, when they're laying flat, you do a straight leg raise test, you'll elicit pain. You ask them to push down or push up range of motion testing with resistance is a great way to determine where the dysfunction is. But as I say, looking at all of these tests, along with that great initial physical exam, will give you answers. And if it's vascular, there are ways to treat that. If it is musculoskeletal, there are ways to treat that. So it depends upon what we find as the underlying cause. Great question.
We have another one.
Another call.
The live chat.
Another question. Live people.
Real people. And what are your thoughts on? Well, I'm paraphrasing, but what are your thoughts on restless leg syndrome? This person says the only thing that works for me is taking magnesium supplements, but even that doesn't completely get rid of it. Just takes it from a life ruiner to a minor inconvenience. I've tried stretching, wearing my legs out during the day, hot and cold compresses, massages. None of that crap worked. I'm cleaning it up.
Well, yeah. So if we understand what the cause is, then we know what won't work and what will work. It's very curious that right off the bat you said that magnesium helps. So it probably correlates with magnesium deficiency. But the question for me would be, just to answer that part of it, we'll get to the rest. Are you taking enough magnesium to raise up the magnesium to fill your red blood cell levels so that your body has a total great level of magnesium? Because serum levels for magnesium can be low, and you can correct that relatively easily by taking the magnesium. How much you need to take depends upon how low you are and how your body uses it up. But then the red blood cell magnesium potassium tests are the best because you need more to fill up your red blood cell. You might need a lot more magnesium until you see the red blood cell levels are great, and then that would help to further decrease the problem. So some people take 100 milligrams of magnesium and think that's a good level. Maybe persons need 600, 700, 800. We don't know until we test them. So the fact that you said right off the bat that magnesium helps, that's pretty important. So massage may not be doing much if magnesium, potassium, or magnesium deficiency is a major cause of the problem. And physical therapy, etc., hot and cold, they may not work because they're really meant to focus on a smaller portion of the problem. So if you have a swelling in your thigh or at your knee and you put a cold compress on it or ice, that may help. But it sounds like your issue with the restless leg is not really coming from, swelling or wear and tear that would benefit using some of the ice or cold compresses. The other thing with restless leg syndrome, we have to test heavy metals because heavy metals are some of the worst things you could ever have into your body at all. Heavy metals, lead, mercury, nickel, cadmium, aluminum, arsenic, all of these things are 2 and 3 plus charge ions. When they get into your system through many ways, arsenic is in chicken, shrimp, rice, apples, California wine, lead, mercury and cadmium in lipstick and makeup, aluminum in antiperspirant, pots and pans, aluminum foil, etc., and the list goes on and on and on, very wide. They interfere with how calcium, magnesium, potassium, and all your 2 and 3 plus minerals get to receptors. So this is the receptor, and the receptors are blocked or bound to the metals. You can't get the minerals there. So that's a direct way why the magnesium can't get to be where it's supposed to be. That may be a little complicated, but that's a reality. So we always test people for heavy metals because they're linked with cancer, they're linked with organ failure. The list goes on and on. So even your discussion about restless leg, my mind goes to other components that may be causing your problem. Maybe your magnesium's not getting to where it should because heavy metals are on board. So again, a little bit of a tangential conversation, but this is real. This is fact. I've seen it. So that's why we do the comprehensive medical nutritional approach, the big blood test. We do blood work for metals, and we also do urine for metals because that gives us the best picture of what's there.
Yeah, and she's I believe her name's Sophia or Sophie. I usually wet a flannel with cold water and lay it across the back of my legs. It helps a lot too. So,
okay, that can help. But I would look at all these other areas because you want to make this a thing of your past and not just have to use the compress or have to use the magnesium to try to piecemeal it. You want to make sure that it's gone. So very important. Great question. Okay, once again, 888-420-9272, 888-420-9272. We're talking about some cool stuff. I'm using my hands much more than I normally would, but that's also good. Louise has emailed us a question about indigestion and bloating when eating various foods, including some of the grains and carbohydrates. I've got to tell you, in 36 plus years of doing this, I get this question every day, indigestion and bloating. More so in the last 7 to 10 or 12 years than ever before, because so much food now is GMO and has all sorts of stuff in it, 30, 40 chemicals in different foods, which are horrendous. And you've heard, and God bless, RFK Jr., he's been fighting against the additives in foods that we have in this country that other countries don't allow. I won't say too much about that, but I'm a fan of his. So there are different ways to react, and many of the reactions to foods affect your gut because that's where you're putting them. And you could be allergic to a food. That's common, and you can do a blood test as a screening tool just to see if there's any antibody found in that little blood test. What I mean is that when we draw blood in one tube for vitamins, one tube for chemistry, one tube for CBC, when we're looking at one tube for allergy, you might have some antibodies near the needle when the blood's drawn, so you might find them. Great. If you don't, it doesn't mean you're not allergic. It just means there were no antibodies near the needle. Antibodies exist everywhere in your body, in your skin, everywhere. So the best gold standard test is intradermal, where we take a tiny needle and raise a little bump of the allergy liquid in your skin and wait 15, 20 minutes for antibodies to get there. If they bind, you see it's positive, then you're allergic, you take that food out. So that's one way that a person could easily have indigestion, bloating, or headaches, palpitations, any number of weird symptoms. The second way, they may not be allergic, but they may be reacting to the GMO component. Or they may not be allergic to wheat on the skin test, but they may have a gluten allergy. So there are different ways to react to those foods. Then there's also the sugar content of the foods. High sugar foods, carbs, and grains are probably the most common culprits for bloating and indigestion. The sugar causes organisms in your gut to go crazy, and that can cause bloating and indigestion. So cutting the carbs, the grains, the sugars out makes a very big difference. And there's traditional medical literature that talks about research on low-carb diets for colitis, for Crohn's disease, for all sorts of bowel-related disorders, and people do better with that. So I'm a big fan of learning about your body first and then cutting those things out that you're reacting to. But most people do very, very well with low carbs and getting rid of the grains. It's just a super common issue. Once again, 888-420-9272. If you'd like to call and ask a question, you can do so now. And Frankie's done a wonderful job. We're here every Monday and Friday, 12:30 or so, for a period of time. And Saturdays, we're also doing live, usually at 2:30, 3 o'clock, depending upon when we can get everything together, depending upon when I get out of the office on Saturday, which is always an interesting question. Let's go next to Donna. Hormone decline has allowed her to gain weight. So very, very, very common question. Hear it every day, all the time. As your hormones decline in some people in their late 20s, more so 30s, 40s, 50s, your body's changing. You're not creating the same repair and the same mechanism you had before. And for some people, thyroid declines. If you look at a thyroid panel, most doctors do T4 and TSH. That's not enough information. I do a 12-part panel looking at T3, T4, TSH, T3, T4 uptake, reverse T3, looking at thyroid antibodies of different types to see what's really happening with your thyroid. In many cases, you'll see the T3 is low. The other doctor won't find that out because they didn't do the T3 test or the others. They just did 2 tests. And when we correct the T3, your body starts to have that energy, that drive again, brain function, focus, and your ability to burn fats and sugars. That can help. When women talk about hormone decline, it's usually estrogen, progesterone, and menopause. But there are a lot of things to look at besides estrogen, progesterone, DHEA, testosterone in women as well. IGF-I, the active component of growth hormone, that's a great fat burner. So we have to look at all of those. And as you walk them back to where you were 10 or 15 years ago, you get your great results again. Hormone deficiency is a very, very, very common thing. Everyone's going to go through it. Some people at a later age, some people at an earlier age. So that's why we hand out hormone deficiency questionnaires to see if you have changes in your hair, your skin, your nails, memory, focus, concentration, vision, smell, taste, irregular heartbeat, weight gain, losing hair on your extremities. In men, this happens a lot. You lose the hair on your legs when your testosterone or IGF-1 levels are low. So we have to take a look at all of it. And then, again, we look at the entire picture, and then we segue from correcting that to low carb, exercise, correcting vitamins and minerals as well. Because your body needs to be fed, and it needs to get the messages from the chemicals to create normal function and ability. And this is not just about thyroid hormone. Brain chemicals, neurotransmitters are important. And as those start to drop, your memory, focus, your mood changes. But that's why we look at the entire picture. And when we correct each of these areas, your body has its best result, best outcome. So, interesting stuff. Great questions today. Yeah. Great questions. So, as I say, we're here to do this a lot. If we're going to get a couple of videos done a few days a week, we'll pop them up there. People can see them. We had a great response to one of the videos we put up, thousands of views, and people are liking and subscribing. So I don't know if other people have to pay for subscriptions. We would never do that. I've never done that. If you subscribe, that's great. We'd love to have the ability to get you some great information every time we do a program. If you like it, send it to your friends and family. We have lots of patients that come in that a relative either saw the video or saw some of the things that we've done on News 12 and other TV venues, or have come to a lecture, and they told their relative, and the relative sees the website, sees the videos, and comes in. So the more information we disseminate out to all different people, I think the better. Being healthy takes work, and it's the knowledge that allows you to become healthy, that extra information that people can't get otherwise. Correct your vitamin levels. Test your blood. If you're taking vitamins and your levels are still low, they're not working. So you think they're working, you think they're good, but they may not be. That's why the blood test is critically important. And then we gauge benefit by rechecking whatever the abnormals are on the first blood test so that you can really see that, oh, yes, my vitamin D levels are now 85. That's wonderful. Vitamin D is a tough one because most people are low in vitamin D. And when people do vitamins on their own, they'll take 500 units, 1,000 units. That's typically never enough for what we've seen. Test before, recommend, and retest to prove result. So some interesting little tidbits, little medical insights into what we need to do. So thank you all for listening. God bless you all. Have a wonderful day. We'll be back on and get some more videos up here relatively soon. Give us a call to the office, 516-794-0404. And the website's drcalapai.com. You could look at all the videos that we do here on YouTube, Spotify, and I don't know all the other 15 platforms. But
all of them.
Yeah, they're everywhere.
If you look,
so
you'll find.
Yes, if you seek, you shall find. Okay, enjoy. Thank you again, Frankie, for a wonderful job. And within the next couple of videos, we're going to have some diagrams, and I'm going to have a tablet or a little iPad mini to do some stuff on. When I did my radio show, we also used to talk to patients and try to get them to send in their favorite, healthy low-carb recipes. We're going to start doing that too, because you have a lot of people out there that are great cooks and chefs.
We have one more. We
one more
actually have one more in the live chat.
Perfect.
You just made it.
All righty.
Hi, doctor. I have some
Better
questions.
late than never.
I have some questions. Okay, about birth control.
Okay.
I am 29 now, have been on it for a few years. I recently had a visit to the ER for a pain behind my left eye, headache. The pain was brought down to the left side of my arm, back, and shoulder. I have concerns that it is the birth control that is starting to cause these concerns. Is that a possibility? It seems I get the pain. Hold on, scrolling. She's still She's still typing. So wait on that.
Well, we always have to be careful with birth control because in some cases that can affect clotting of your blood. So when women take birth control, we always have to keep checking the clotting factors, make sure they're on a little bit of fish oil or some of the good nutrients that can help to prevent that. I don't know that I could say that pain behind the eye would be just...
It seems I get the pain, severe eye/head pain right around the time of cycle. These are all new symptoms. The headaches have become so bad where I can't even open my eyes.
So when the birth control pills are used, the hormones levels fluctuate. So it may be that the estrogen level is going up too high, and that may be giving her a symptom. She may need to change that pill. And certainly I would look at her blood work, look at her clotting factors, make sure there's no, plaque. Even do sonograms of the neck to look for plaque in the blood vessel of the neck to make sure that there's not something else that's going on. But it may be that when the estrogen in that pill increases, it's going up too high and causing, to have some of those symptoms. If she correlates it that directly. Doing a blood test has to be done at a specific time so that when you have that symptom and that starts to occur, you want to get your blood test done then. Look at inflammatory markers, SED rate, C-reactive protein, look at the estrogen levels so we can see exactly what's happening in the blood when you're having the symptoms. So that would be important to come in to do that. But very curious. The other question would be, do you have any problems with your neck? Do you have issues with neck pain, disc problems? Also, headaches can come from food allergy, but it wouldn't be that food allergy would cause a headache and then the headache goes down to the arm and the back. So I would look at the musculoskeletal system in part for that, because you could have a disc issue that's causing the headache and also creating pain going down to the arm. If you were in front of me, I'd ask you a million questions. So it's a little bit hard to give you the ultimate answer.
Well, I'll add because we're doing this every week. So if you have additional questions to the email.
Sure. You can email the office, the website, drcalapai.com. Most of our patients hit that, look at the videos, email us directly, and we answer them right away.
Yeah, she said, I've had some issues with neck pain as well.
So it may be a combination problem in the neck causing the eye issue and the issue going down her arm. That would be much more likely than just the hormone doing that. But I would look at both. I'd look at all of it, Have to look at all of it. Great question. Thank you so much for that question. And obviously we love questions, because if there are tons of people out there listening, like they used to be on my 35-year radio show, you're asking a question that someone else has the same problem, and they want to learn and need to know about that. So the more questions people ask, the variety of questions, the better. It always helps someone else out there when you ask the question. Some people are a little shy, don't want to get on and ask, but I tell them, ask. There's no wrong questions. There's no wrong, way to propose these things. So
she said she'll email and she'll call the office. So,
terrific. Love that. Wonderful. We're here to help you out in every way, shape, or form. So do we sign off again and see if anybody else is going to come on last minute? Yes, thank you all for listening. We'd love to hear from you. You can go to the website, drcalapai.com. Office phone number is 516-794-0404. And I promise we're going to continue to do more and more programs every week.